What is post-traumatic stress disorder? Post-traumatic stress disorder is more commonly known as PTSD. And it's an experience that we have when we're faced with a trauma that's outside of our normal range of experience. And we respond to this within actually after a 2-month period where we begin to feel a sense of apathy, of depression, a disorientation in life. We become more easily agitated. Sometimes we repeat the experience in our mind over and over, or we have what we call flashbacks of the experience. We'll see reminders of it and have that. Well, what causes the disorder for PTSD? It's when we have an experience that's outside the normal range of human experience. We are involved in a tornado, we're involved in an earthquake, a terrorist attack, a flood, something where there's a great tragedy that takes place. It can happen to us, or we can actually witness it happening to somebody else, like a car accident we can see in front of us, and ourselves can suffer from PTSD later from having actually just witnessed that experience. Why are so many human beings prone to this disorder? Every one of us run the risk of experiencing a tragedy in our lives at any point. We watch the news, we see tragedy taking place in other people's lives, in other people's worlds, and we realize that this could be a possibility for ourselves in our own life. What makes us more prone to experiencing PTSD is the stress that we're under at any given time, or our support structure that we have. If we have a tremendous amount of stress in our lives, we are more prone to experiencing a post-traumatic stress disorder response. If we have a good and strong structure of support, we tend to heal ourselves more quickly and may not actually go into PTSD from that experience if we can talk to somebody. What are some of the symptoms associated with PTSD? Some of the symptoms are a feeling of disorientation, a feeling of depression, apathy, inability to complete tasks. Sometimes it's anger, just a rage that comes out. Spontaneous crying takes place also for people. And those are some of the symptoms that we experience with PTSD. How can PTSD be treated? The best treatment for PTSD is seeking treatment immediately after any experience. It's being able to talk with someone who is going to listen to you, who cares about you. So what you want to do is you want to find somebody who wants to listen, who's willing to hear what you have to say, and willing to hear what you have to say repeatedly, because very often we will repeat over and over the experience until we work it out in our minds. And we might have to say it 100 ways, slightly different each time, before we can wrap ourselves around it and get a sense of control of it and find a way of healing ourselves. What are the most important factors for influencing an individual's recovery? The two most important factors are the stress levels they were feeling before the event took place and the level of social structure support that they have in their lives currently. People don't really experience PTSD until a later time, and oftentimes it's 2 months or 3 months down the road. Something that's really important about disasters is that we oftentimes don't prepare for them. And one of the reasons we don't prepare for them is because they're always running in the background. In California, it might be earthquakes. In the Midwest, it might be tornadoes. In the coastlines, it would be hurricanes. And you hear about people that sit out a hurricane, or they're out in a cornfield and they're watching a tornado with a camcorder, and they're not really running for shelter. And one of the reasons is because during times of crisis, we oftentimes shut off the fight-flight syndrome so that we can cope with what is occurring with us. But at the same time, it also dulls our senses to what's reasonable in escaping a very dangerous situation. We don't prepare because we live in a little bit of denial. We cut off from that buzzing possibility of a disaster happening in the background. And then we don't prepare our earthquake kits or the hurricane route or the shelter for the tornado. So it's really important for people to understand that they have to prepare for these things. They can't just take it in a very lackadaisical way, because when they're doing that, what they're doing is they're just cutting off to the fight-flight response that they really need to be responding to at this time.